So let's do some work and look at the cases. So the first case was a patient who was 24-year-old with a chest mass. That's Phil's case. But I have the slides, so let me share the histology. So we're going to show this case and ask you for your diagnosis, I think, first. So Phil, like, what do we see without revealing the diagnosis here?
Yeah, so there's a dome surface papule, and it's there's a proliferation uh, of epithelioid-looking cells in small nests in the dermis within fibrotic stroma, and some of the nests are solid appearing, and then I keep on getting um, emergency notifications on my phone because there's been a 7.0 earthquake in the Pacific Ocean outside Eureka, and there's tsunami warnings for the West Coast. But our elevation is such that we won't be interrupted by the tsunami, which is supposed to occur in exactly 2 minutes.
Okay, so let's see, Phil.
So if my screen goes blank,
If we start shaking, we
you'll
know what's going
you'll know
on.
what's happened.
Oh
So we
gosh.
have so we have these solid appearing aggregations of epithelioid cells, and in some of them the cells are arranged in a ring. Then there are other aggregations that are of about a similar size, but you can see a little lumen in the center of the aggregation. And then there's others that have erythrocytes in more dilated lumens. So one could think of a non-vascular epithelioid neoplasm in which there's been some hemorrhage, but the erythrocytes in the centers of those aggregations are very reproducible. And I think you also passed by some vessels, some structures that were more obviously vascular, like this one here, that may actually have some lymph fluid in the lumens and a few lymphocytes floating in them. And then other structures that have vacuolated cells.
Yeah.
So I'm trying not to give the game away here.
Yes, no, but I think
Good.
that's a perfect, wonderful description. So folks, you can go to the Mentimeter, enter your diagnosis. What do you think? What is the diagnosis in this case? I'll keep showing a little bit more for pictures for those folks who are already done with the voting. And yeah, so go to the Mentimeter and type in your diagnosis if you can. What do you think is the H&E diagnosis? And here I'm not giving you options. I am just asking to type it in. Okay, so let's see how the Mentimeter is doing. And I give you 20 seconds. So, epithelioid hemangioma got some votes. Epithelioid hemangioendothelioma got some votes. Angiosarc, Bapoma, nevus. Well, quite diverse. And the next question I have for you, which of the following states may be helpful in establishing the diagnosis? And here you can choose, all four of them. I narrowed this down. Obviously in the real life, we probably would, or would consider expanding our panel, but here, which would be of particular interest to you? Okay. And you can put as many as you think, as you like. So we'll have kind of a voting in terms of which one is favored or expected to be positive, I guess. Yeah. So ERG, D240, CAMTA1, and if three votes for synaptophysin. Okay. So, Phil, we can go back to the case. What's your take on this case, and how did you approach it?
Yeah, so when I first looked at this, I was I was struck by the solid areas, which I didn't think were giving away the lineage of the cells within them um, very easily. They were playing tough.
Hmm.
Um, but then there were those aggregations that have erythrocytes in them. That really didn't look like just, bleeding into a tumor where you could get some erythrocytes, say, in the middle of a melanocytic nest. That truly looked vasoformative to me because the erythrocytes were consistently in those spaces and not out in the stroma. And then there were also those areas that looked more like lymphatic vessels, where there were more dilated lumens with some pale material, just like that one. And also the contour of the vessel isn't oval; it's an irregularly shaped vessel. And there were some vacuoles in the cytoplasm of some of the cells. So putting all of that together, I thought that this is probably a vascular neoplasm. The vacuoles are particularly interesting because in embryonic life, the way vessels form is first you get basically a line of cells. They develop intracytoplasmic vacuoles. Then the vacuoles merge with each other, and that's how a vascular lumen forms. So the vacuolization is really sort of an atavistic trait. It's a throwback to embryonic vessel formation.
So like here, yeah,
Yeah,
those are
exactly,
those
exactly.
vacuoles. Yeah, yeah,
Yeah.
yeah. So
So
let's see what people think. What is the diagnosis? Yeah, if you could just go to the Mentimeter and just very, quickly, um, choose from the suggested vascular lesions. Yeah, and I'll give you 10 more seconds. So what are the alleles? Epithelial hemangioma, hobnail hemangioendothelioma got some votes. Epithelial hemangioendothelioma got some votes. Okay, so Phil, your diagnosis here was,
yeah, so I did this was not a diagnosis that I just sort of looked at the slide and said this is a composite hemangioendothelioma.
uh-huh.
Um,
Oh, wasn't it?
so I basically thought this is some kind of epithelioid vascular neoplasm, and I
Mhm,
should think about firstly just an epithelioid hemangioma,
mhm,
and then those elongated lumens that were lined by very protuberant endothelial cells, some of which are in this and some over there. It made me think, is this a retiform hemangioendothelioma?
mhm.
And then the retiform structures were combined with the solid ones. So that's a little less straightforward. And then I started thinking about composite hemangioendotheliomas. It's a diagnosis I've made only, I probably 2 or 3 times. And I did think about epithelial hemangioendothelioma as well. And that often has um, sort of myxohyalin kind of stroma. And there's a little bit of a suggestion of that there, but it wouldn't have the retiform structure. So I thought composite would work.
Hmm.
And so that's how I got to that diagnosis. The
Hmm.
monomorphism, the nuclei are large, but they're not strikingly atypical. And the uniformity, the aggregations, the small size, the fact that it's forming a papule are all things that I thought helped exclude an epithelioid angiosarcoma. Because that, like in a situation like this, you always want to think, what's the worst thing I could possibly miss? And it would be that.
Yeah, I think excellent. Yeah, when you sent me this case, I got the slides without the diagnosis, and when I look at it, my diagnosis initially was retiform hemangioendothelioma. Yeah, and the way I it's not that I studied it, as one would, as a consult, but for me, the starting point was observing that, first of all, getting that this tumor is vascular, and then that it has hobnail endothelial cytology, right? So, but then, that those solid areas, those nested areas are kind of unusual, right? And
Yeah.
yeah, and they are somewhat hemangioendothelioma like in appearance. So, but there's another twist to this case. I understand, right? So here's a little
Yeah.
summary of the features of composite hemangioendothelioma, or about this entity.
Right. Yeah. And this is one of these lesions where it would be nice if there was a single molecular event that produced this tumor in a uniform fashion. But there's at least 3 different gene fusions that can do it. 2 of them involve mammal2, which is something that we think about with nodular hidradenoma and uh, mucoepidermoid carcinoma. Um, the YAP fusions are, ones that we think about with poroid lesions. Um, and that the intermediate biologic potential of these is such that you do want to always get them excised, but there's a few that are bad actors, and there's some recent correlation of that with some immunohistochemistry.
Okay, what is it? The
Well, these endothelial cells, read your paper on mucin secreting neuroendocrine carcinoma of the eyelid, and they said, why can't we do something similar and show neuroendocrine differentiation? It's very creative what our brethren on the island did. And so there's a few cases of composite hemangioendothelioma that have shown neuroendocrine differentiation, and the key stain for that is synaptophysin.
Yeah,
Um,
and I think I have it. I'm going to show it right now. And in this case, mm, no, I'm not sure.
that looks too good to be
Yeah,
true
that
for
was ERG.
synaptophysin.
This was ERG. I have smooth muscle actin, which is kind of important case, maybe
Oh
to,
yeah.
it's helpful.
Let's talk about the actin stain, because I think that's
Mm-hmm.
that's pretty useful.
It's useful, yeah.
Yeah, because like if you have a lot of pericytes, it makes it really unlikely that you're looking at either Kaposi sarcoma or angiosarcoma.
Mhm.
Um, those are two diseases that in which pericytes are really absent.
Yeah.
There's a variant of angiosarcoma that Juan Rosai described. I think he called it pyogenic granuloma-like angiosarcoma, where you can have vascular lobules with pericytes, but it's pretty rare.
Mhm. This is
You know that,
CD56, kind of a
yeah,
subtle.
yeah. So that's another way of getting at neuroendocrine differentiation in these, and there's a little bit of it here.
Mhm. Yeah, it's very kind of a subtle and focal, and then there's a stain that's marked unstained. So maybe this is another neuroendocrine marker that you have performed. Maybe that's synaptophysin.
Yeah, I think this is the synaptophysin. That's right.
Synaptophysin, yes.
Yeah.
Hmm.
Yeah. So what it is that we don't have synaptophysin in the dermpath lab at UCSF. So we send it over to surgical pathology and they stained it for us. That's why
And that's also important stain. It's D240 because
yeah.
like all the hobnail vascular lesions, these are lymphatic. These lesions are of lymphatic lineage, all,
Yeah.
retiform hemangioendotheliomas and DAPSCA tumors and composite hemangioendotheliomas will have D240 expression. Okay, so is there a correlation with neuroendocrine and worse behavior or not?
Yeah, there is. So there so I think that I'm not sure who the first person to observe this was, but I think the one of the bigger series of these came out of the Cleveland Clinic.
Mhm.
Um, and Brian Rubin, who's the chair of pathology at Cleveland Clinic, has really done some fantastic work with epithelioid hemangioendothelioma. And that that same group put together a series of composite hemangioendotheliomas with neuroendocrine differentiation. And I think their series is one of these where it's, 7 cases from 6 institutions or something like that. These are not, it's not a common combination. One of the cases actually came from UCSF. My colleague in soft tissue tumor pathology at UCSF, Andrew Horvai, had a case. I can't remember what
Mhm.
body part it was. I think it may have been laryngeal or
Mhm.
something internal. But they observed in their series of composite hemangioendotheliomas that the ones with neuroendocrine differentiation were more apt to metastasize.
Mhm.
Um, those were mostly, as I mentioned, internal lesions. Um, I hope that this being a small, very small lesion and being very superficial will lead to a better outcome. But I think in my report I noted that with this association, that metastatic capacity is increased compared to other hemangioendotheliomas.
Okay, I think we really learn a lot about that entity. And yeah, the hobnail vascular lesions are very pretty.